Hello class, today we're going to discuss the topic patient environment and safety. This can be found in your textbook on page 321, chapter 20. Upon completing reviewing this chapter, as well as reviewing this presentation, you'll be able to discuss nursing responsibilities for environmental management, identify common noises in healthcare facilities and ways to minimize their effects on patients. Also, explain the importance of neatness and order in the patient's environment. You'll acquire knowledge that you can bring to the clinical setting. You'll be able to discuss how the healthcare facility's environment affects your patients, as well as using correct techniques such as making an unoccupied and occupied bed. So, the environment is the total of all elements and conditions that surround us and influence our development. Caring for the patient's environment is extremely important in providing holistic care. Your goal as a nurse is to ensure safety while making the patient comfortable as much as possible. Florence Nightingale wrote about environmental factors that needed to be controlled more than a century ago. These environmental factors include temperature, ventilation and humidity, lighting, odor control, noise, interior design, neatness, and privacy. Because of their poor thermal regulation, infants and older adults may need their rooms warmer than other patients. Keep room temperatures between 68 and 74 degrees Fahrenheit. Operating rooms and critical care areas are usually kept slightly cooler to reduce the patient's metabolic demands. Ventilation is the process or act of supplying a building or room with continuously fresh air. Most healthcare agencies or facilities have central air conditioning units that regulate the temperature, humidity, and air exchange. Fans are discouraged because of infection control concerns. Do not open windows in the hospital. Humidity is the amount of moisture in the air. A range from 30 to 50% is normally comfortable. Very low humidity, dry skin, and respiratory passages. Lighting. A sunny, cheerful room can improve a patient's spirits. Areas must have adequate lighting for tasks and to prevent accidents and injuries. The light should be bright enough to see without a glare and to avoid eye strain, and be soft and diffuse to prevent sharp shadows. Ideally, your patient will be able to control the light independently. Appropriate interior and exterior lighting in the home helps prevent against crimes. When considering environmental factors, odor is certainly important to manage. Some patients may complain about odor in their rooms. Illnesses changes sensory perceptions. Odors that ordinarily are present may make the patient feel nauseated. In order to control the odor, empty rinse bedpans, bedside commodes, and urinals promptly. Dispose of dressing and used equipment immediately. Nothing odorous should be placed in trash in a patient's room. Avoid the sources of odors. Remove old flowers and stagnant water. Perfumes, scented lotions, or scented cosmetics should not be worn in the patient's areas. Please note, I highlighted something in red on this slide, as this may be an important factor or takeaway for consideration for your exam. So when you're doing an environmental scan of a patient's room and they're complaining of odor, certainly look to see what the source is. There may be stagnant water or even old flowers in the patient's room causing the odor. As a nurse, your responsibility is certainly to keep the patients safe and ensure that they have a pleasant stay in the facility. The hospital should be a place for rest and quiet, yet some patients may experience sensory overload from noises. The main source in a hospital causing noise are people. Soft, pleasant background music can mask other sounds and promote relaxation. Consider these techniques in reducing noise by avoiding long conversations in the hallways. Encourage staff to speak in a lowered voice. Avoid joking and laughing at the nurse's station. And answer alarms on IV pumps and equipment promptly. Patients' rooms in public areas are often more like a hotel now, and opposed to stark white of the past. Rooms are tastefully decorated. The goal is to provide a home-like environment for patients. When considering neatness, it is important to provide a neat, tidy atmosphere for your patient. Keep the unit in enough order to be safe. Straighten the patient's unit after making the bed and whenever appropriate. Remove trays and dishes promptly after meals. Keep the over-the-bed table clear of unnecessary clutter or equipment. Privacy is essential for all patients' well-being. Always knock gently and identify yourself before entering the patient's room. In multiple patients' rooms, close the curtain around the patient for personal tasks such as using a bedpan and bathing. Post a sign on the door informing others of such tasks to discourage them from entering the room. A healthcare facility mattress is usually firm and has a covering that can be cleansed easily between patients. An overlay, air or gel filled, may be used with a mattress to reduce the risk of pressure injuries, but newer mattresses are designed to reduce pressure areas. Beds used for healthcare are usually on wheels and equipped with side rails. The patient may use the rails to change position or get out of the bed. Specialty beds, such as low bed frames, may be used for someone who is at fall risk. You need to make certain that the mattress fits snugly to the rail and the rails are close enough together so that the patient's head is not able to fit through them. Always check to be certain the bed wheels are locked unless you are moving the patient or moving the bed. Bed rest is certainly an important part of the patient's treatment plan. Most patients can get out of the bed during their stay, but there may be times where they're unable to get out of the bed. Unoccupied bed. You will make the bed when the patient is out of the bed into the chair or out of the room for a procedure. Occupied bed are made only if the patient absolutely cannot be out of the bed. When making the bed, consider bed linen should be always neat, orderly, and free from wrinkles. Here we are, question number 1. Florence Nightingale describes 6 elements of environment. They are A. Temperature, ventilation, humidity, lighting, odor, and noise. Is it B. Temperature, ventilation, safety, lighting, odor, and noise? C. Temperature, circulation, vaporizers, lighting, sensory and perception, odor, and privacy? Or is it D. Temperature, ventilation, neatness, lighting, privacy, and safety? Please post your response. The answer is A. Florence Nightingale describes 6 elements of environment, which are temperature, ventilation, humidity, lighting, odor, and noise. Let's move on. Question 2. Which is not an appropriate guideline for bed making? Is it A. Check to make sure the bed wheels are locked. B. An occupied bed is made only when the patient cannot be moved or taken out of the bed. Is it C, unfolding linens into the bed? Or is it D, place soil linens on the floor? The answer is D. You do not place soil linens on the floor. Let's move on. Upon completing this section, you'll be able to describe methods to prevent mechanical and thermal accidents and injuries in healthcare facilities and at home. You'll be able to discuss the various forms of bioterrorism, safety measures to be taken, signs and symptoms of agents used, and measures to treat or contain the threat. You'll be able to discuss the principles for using protective devices and also demonstrate knowledge of the legal implications of using protective devices. You'll acquire knowledge that you can apply to the clinical setting. You'll be able to explain, according to your facility's procedures, how to clean up a biohazard spill. Also discuss your clinical facility's response plans to a bioterrorism threat. In addition, you'll be able to give an emergency scenario, practicing triaging the victims. Lastly, you'll be able to correctly apply an extremity immobilizer. The primary concern in providing patient care is safety. Safety is needed to prevent accidents and possible injuries to patients, visitors, and healthcare professionals. Most common patient accidents and incidents include the following: fall, burns, cuts, fights with others, loss of possessions, choking, as well as electrical shock. Please review box 20-3 for ways to promote patient safety. This can be found in your textbook on page 330. Please note, there are 3 common factors causing falls. This is highlighted in red as this will be covered on your exam. Please familiarize yourself with all 3 common factors. In assessing your patient for fall risk, you want to assess whether this patient has impaired physical mobility. You're also going to assess the patient's mental status. Is it altered or are they oriented? Lastly, you're going to assess your patient's sensory and/or motor deficits. Patients at risk for falls may need a leg or bed alarm. Burns. Burn prevention includes protecting the patient from accidental thermal injuries and the threat of fire. Thermal injuries may be caused by either hot or cold materials. A patient who has diabetes, impaired circulation, or paralysis, or who is taking medications that alter mental awareness is more easily burned than a healthy person. To prevent these injuries, use a barrier between the patient's skin and the thermal application. Check the temperature of oral liquids before giving them to your patient. Warn the patient if a food or drink is hot. Caution the patient to avoid lying on or sleeping with heating pads or ice packs. Also, ensure to inspect any electrical cords or frayed or broken areas that may cause sparks or fires. In most healthcare facilities, smoking has been banned. Some long-term care facilities allow smoking in designated areas. Carefully supervise a patient who wants to smoke and is sedated, confused, or irrational. Smoking is never allowed when oxygen is used because of a spark can certainly cause a fire. Any equipment that may cause a spark is also prohibited near oxygen. It is your responsibility to familiarize yourself with your institute's fire regulations. Know the locations of the fire extinguishers, fire alarms, and escape routes, and how to notify the telephone operator of a fire in your area. Should a fire occur, you must rescue any patients in immediate danger by removing them from the area, activate the fire alarm system, contain the fire by closing the door, and extinguish flames with an appropriate extinguisher. In your textbook on page 332, you can find the acronym PASS, which serves as a reminder for using a fire extinguisher. Familiarize yourself with this acronym. Nursing actions that will promote safety in the healthcare facilities. Your role as a nurse is critical in making sure that the patients do not acquire injuries in a healthcare facility and remain safe. Orient the patient to the unit upon admission. Assess patient's gait and assess them for fall risk upon admission as well. Evaluate patient's drug regimen for side effects that can increase the risk for falls. At all times, make sure that the bed is always in low position when not giving direct patient care. Toilet the patient on a regular basis as well. Additional nursing considerations to promote safety in the healthcare facility. Always ensure that the wheels on a bed are locked. Provide a nightlight for going to the bathroom. Encourage the patient to use non-skid slippers. Always answer call lights promptly. Tell the patient when you will next check in. And encourage patients to use grab bars. Nursing actions to promote healthcare safety continues. Place high-risk patients in a room close to the nurse's station. Be sure that the patient's call bell is well within reach. If a patient is confused or unsteady, be sure that they're not left alone and stay with them, or provide additional supervision. Provide diversionary activities for confused patients, and make sure that the wheelchair and brakes are locked. Here are some additional takeaways for promoting safety in the home. Place a non-skid bath mat in the tub or shower. When assessing the patient's home environment, make sure that they have some night lights available so that they can find the bathroom. Suggest installations of grab bars in the showers if they don't have any. Install door buzzers or bed alarms. Encourage the patient to maintain safe arrangement of furniture. Also, in assessing the patient's home environment, if you see any loose extension cords, encourage them that they remove them out of the way so the patient does not trip over the extension cords. Caution the patient about toys and animals, and also provide appropriate community resources for them. So, biohazards, a biologic agent, chemical, or condition that can be harmful to a patient or person's health is considered a biohazard. OSHA publishes specific guidelines for labeling, handling, cleaning spills, and disposing of these materials. Material safety data sheets are consulted for recommended methods of storage, labeling, handling spills, and disposal. You are responsible for knowing where the MSDS is located in your facility. Bioterrorism, the release of pathogenic microorganisms into a community to achieve political and/or military goals, is considered bioterrorism. What is meant by chemical terrorism? This is the use of certain compounds to cause destruction to achieve political and/or military goals. Also, radioactive substances attached to an explosive device, which disperse radiation is considered a bioterrorism agent as well. Please note this list contains your common diseases spread through bioterrorism. When a terrorist attack has occurred, a portable decontamination unit with a specialty trained staff is set up outside emergency departments. The staff must wear masks and protective clothing that are impervious to chemical and all skin surfaces. Staff must wear masks and protective clothing that will protect their skin. Military missions-oriented protective postures or MOPS suits may be used. A chemical mask with filter respirators must be worn with the suit as well. Patients are triaged as they enter the ED. When you're assessing your patient, you're going to label them according to the priority of care. You'll label them as immediate, delayed, minimal, or expectant. Treatments are based on these type of agents to which the patient was exposed and the degree of exposure. So poison is a substance that, when is it ingested, inhaled, absorbed, applied, injected, or developed within the body, may cause functional or structural disturbances. Some poisons do not have antidotes or treatments. Treatments and antidotes obtained from a poison control center are listed on some containers. In the event of suspected poisoning, contact the poison control center. Have the label of the product in front of you and ready to report. Name the product, patient's age, amount you believe was involved, and any symptoms involved. Protective devices, formerly called restraints, were used in the past and may not be allowed in certain long-term facilities. If they are allowed in a setting, then strict rules will certainly apply to how long the patient has the device applied, as well as how frequent you should assess your patient. Restraints are used in two types of situations, for behavioral or non-behavioral indications. A protective device is used when a behavioral health reason, if the patient is in a psychiatric setting or has demonstrated a sudden change in mental status or behavior. Non-behavioral use is for the continuation of medical treatment. It is your responsibility to be aware and to follow the regulations within your healthcare facility and area. In the past, some staff used protective devices as a way to punish or discipline patients. This is an illegal, unethical, and unacceptable practice that constitutes malpractice. Now, there are federal and local laws which protect the patient from physical and mental abuse and from physical and chemical restraints, except those that are authorized by a physician in writing, for a specific and limited time that are needed in an emergency. So our standard of practice in healthcare is to consider alternatives to restraints before using them. The goal is to move to a less restrictive environment. Healthcare workers, such as yourself as a nurse, are encouraged to find alternatives to the use of protective devices. Family and friends of a patient who is confused can be encouraged to sit with the patient to promote safety. So the principles related to the use of protective devices. Remember what I stated in the previous slide. Using protective devices is not meant to be punitive. You want to use protective devices in order to help your patient continue medical therapy. Use the least amount of immobilization as possible. For all restricted devices, there must be a written order, and as soon as the device is no longer needed, notify the physician so the order can be discontinued. Apply the device snugly but not too tightly as to interfere with blood circulation or nerve function. Please make note of what I have highlighted here in red, as this will be covered in your exam. Protective devices such as a vest protection must be removed, and you must position change your patient every 2 hours. Again, Remove it every 2 hours, and patient's position change should be done every 2 hours. Okay, home stretch here. Question number 3. Most agencies use the RACE acronym to respond to a fire because it is easy to remember. In your textbook on page 332, you can find the definitions for RACE. Which letter below is correctly identified? Take a moment to review this. The correct response here is B. The letter A in RACE stands for Activate the Fire Alarm. Question 4. Melanie is working in the emergency room. Her patient is vomiting and has diarrhea, a loss of appetite, skin damage, and the potential for seizures, coma, or death. The patient informs Melanie that she was exposed to a high dose of radiation in a short period. What does this sound like? Does it sound like anthrax, botulism, acute radiation sickness, or radiation contamination? The correct response here is C. This sounds like acute radiation sickness. Final question. Darby is a nurse working in a long-term care facility. She needs to use protective device on her patient to ensure safety. When applying protective device, it is important to remember all of the following except for which one? Is it A, try an alternate method first? B, you should be able to easily fit your index and middle fingers between the patient and the device? C, secure the ties of a protective device to a movable part of the bed? Or is it D, at least every 2 hours remove the device and provide passive range of motion exercises? I'm sure you all figure this one out. The correct response here is C. You should not secure the ties of the protective device to a movable part of the bed frame. The end. This concludes my presentation to you on patient environment and safety, covering the chapter 20 in your textbook. Thank you.